We're not talking heads. Hey, here we are. We were talking heads for a second, so we had to fix that.
Yeah.
And now we're like, weird angle. Anyways, today we are talking about B12 and all of its loveliness, because like a lot of people have B12 deficiency, right?
Yeah.
It's pretty common. And so that's what we're going to talk about today here on Tea Time. And for some reason, I forgot to. It's not really upsetting to her because she doesn't really need it.
Really
Sometimes I need it for a pick-me-up, but see, the caffeine in it does crazy things with my heart, so I have to be careful about.
Wow.
Yeah, it makes my heart go crazy. Pitter patter. It's not even in regards to love. It's caffeine. I only love caffeine. Water. Got water though.
I am a caffeine fan. I'll admit that. I like my caffeine, just not that form of tea.
Yeah, you like coffee.
I do.
Okay, so welcome. If you don't know who we are us, and I am Dr. Smith, and I am from Accomplished Health and Wellness here in Lawrence, Kansas, and this is Heather Fiore from Free State Nutrition here in Lawrence, Kansas. And we're going to talk about B12 and all of its loveliness, and we're going to do this in under 30 minutes. Timer's going now.
Ready, go.
Okay, so what does B12 do in our body,
yes.
Right? That's a big deal. And B12 actually plays a role in DNA synthesis and also neurologic function. And so it's actually associated with a lot of things that go along with that, right? So you have psychiatric things that happen, you have neurologic things that happen, and then you have hematologic things that happen. And that's all related to DNA synthesis and then the neurologic function. So the one thing that we see, there's a few things that are hematologic. So hematologic means blood. And so one is megaloblastic anemia. That's like easier to see on the paper than to say.
I don't even know if I've heard of that kind of anemia.
Megaloblastic anemia. So when you're looking at your blood counts, so we've talked about blood counts before a little bit, and we've talked about with iron deficiency, we talked about our MCV. So when you're looking at your MCV, if it is greater than 100, that is considered megaloblastic anemia, and it means that the immature cells are big. Okay, so iron deficiency, it's less than 80, and that means it's microcytic, so their cells are small. So these are big cells. So we see that oftentimes in B12 and folate deficiency. That's what we see.
Yes.
Big cells. It also causes pancytopenia, so it just messes up all of your cells. Well, that makes sense because it's plays a big role in DNA synthesis, and that plays a big role in your blood cell formation. Right?
Sure.
So there you go. So that's those two. Neurologic. It causes numbness and tingling. We call that paresthesias. That's a really hard one to say too. I don't know why they made all these words so hard to say. No idea.
You're talking about deficiency causes numbness.
Yes.
Okay.
Okay,
All right, go ahead.
Yes. Peripheral neuropathy. So, we usually think of peripheral neuropathy with diabetes, right?
Yes, we do.
And heart disease, but also B12 does it too.
Wow.
Yeah. And it also does combined systems disease, which is actually demyelination of your dorsal columns and your corticospinal tract. So it just basically, your spinal column, your spinal nerves can't have, the myelin doesn't form around it properly. And without the myelin is like, if you think about a wire, right? You have that coating,
the rubber around it.
Yeah, that coating that goes around it. And so that coating, it would be the same as your myelin. And if it's not there, then the nerve impulses can't jump from impulse to impulse to travel down your nerve. So that's what B12 does. It helps with that. Was that?
That was my foot.
Oh, okay.
Sorry.
Okay. We might have a little bit of some B12 today because deficiency, because we're both a little irritable. And that's what it causes. Some of the psychiatric stuff is like irritability or mood instability, depression, fatigue. We hear a lot about fatigue. It can cause psychosis, but that's like really severe. Okay, we don't ever really actually. I mean, I'm sure people see it because it's on there.
Mm-hmm.
But I've never seen it from B12. I just don't know that unless you're in the hospital, people get that low.
Okay.
Like they're not walking into your clinic that way.
Right. You probably have some sign before that.
Oh, yeah.
Maybe several signs.
Yeah, I would think so.
Okay.
And then obviously increase risk of cardiovascular disease and stroke, right?
Mm-hmm.
So that's for me.
Yeah, I see that.
So anyways, that was a baby bed.
Okay, good.
Yeah. Okay.
All right.
Back on track. Okay. So anyways, it can also cause that. And that's probably also related to your blood cell formation and DNA production. So
Sure.
those are all things it causes. So, why do we care?
Well, who might even have a problem with B12?
Lots of people, yeah. Who does have a problem with B12? Elderly will have a
Mm-hmm.
problem with their tea and toast diet.
Right.
But
Well, and absorption too, right? Don't
Yes.
they just have like less
Yes.
absorption overall?
Yes. Also people, so there are people that have an inherent deficiency of intrinsic factor. And so maybe we should talk about how you get B12. So B12 is going to be in your food, right? And you're going to take it in. And then in your stomach, you actually have to have acid production. And then that acid production is going to break the B12 off of your food.
Mm-hmm.
Okay.
Mm-hmm.
And so then the B12 will then bind to intrinsic factor in your stomach. And then that will make this intrinsic factor B12 combo. And then that usually happens in your duodenum.
Okay.
And then that combo will actually go all the way around and then your B12 is absorbed in your terminal ileum. So when you're like thinking of your intestine, that's a lot of big words, right?
But
so
that's the last minute, basically.
Yeah, like it is.
Yeah.
That's like the minute before it enters your large intestine.
Yeah.
So it starts in the stomach, right? And then it has to be coupled to this intrinsic factor.
Yeah.
And then it goes down all of your small intestine before the last minute it's absorbed in. So anyone that's going to have like a missing stomach for whatever reason, so like gastric bypass.
Yes, of course.
Or like people that have had a sleeve and they've taken out a big section of the stomach.
Yeah.
People that have inherent intrinsic factor deficiency.
Mm-hmm.
Anyone who's like gonna have some kind of gut issue.
Like absorption.
Yes.
Celiac disease.
Yes. Yeah, because they're not absorbing.
Right.
And so also people that have a missing ileum, like not because it's missing, but because it's been taken out for some reason, right?
Sure.
Those people are going to have some trouble.
Makes sense.
So
also vegans.
Yes, because they're not eating it.
Right.
Yeah. Yeah.
Pretty much.
So there is actually, so this is where like 99% of, this is how 99% of your B12 is absorbed.
Mm-hmm.
However, if you don't have intrinsic factor, there is still hope for you. Okay. So the thought has always been that if you don't have intrinsic factor, you need to be injected, right? And so that's why they get injected, because it bypasses that.
Mm-hmm.
So then they've actually looked at that a little bit closer, and they have actually found that there's a secondary pathway that completely bypasses your intrinsic factor. And what happens is it binds to this other protein called transcobalamin. So B12 is called cyanocobalamin,
Mm-hmm.
and so that's why it's nice that this one's called transcobalamin, because it transports the cobalamin.
Yeah, that even makes sense.
Hey, I can remember that.
Yeah.
Sometimes medicine is so hard, and sometimes it's not.
Sometimes it actually makes sense.
Yeah, sometimes we get an easy button. Anyway, so then this complex is then transported all the way through the body, and it can be absorbed that way.
Cool.
So what they have found is that people that don't have intrinsic factor just have an upregulation of this transport mechanism. And so you can still absorb it. And the thought is that you can still absorb it just as much when you have oral.
Oh.
Yeah. Oral oral B12.
Uh-huh.
Maybe that's why. you can do that. Maybe that's why it does liquid,
Liquid. Yeah.
because we were talking about that before we
Liquid
started.
supplements.
Yeah. So anyways, how do we look for this? Sometimes first off, you would have a B12. Whenever I draw a B12 level, it's a blood test. It's from your blood. You get a poke, and then we draw it.
Mhm.
And I always check B12 and folate together. I just always do.
One can mask the other, yes?
Yes. And that is why I always do it.
Mm-hmm.
Because then I can tell. So if your B12 is low, then you need other tests, okay? So you need to have a folate level. You
Yeah.
need to have what's called an MMA, which is methylmalonic acid. And then you need to have a homocysteine level.
Mhm.
And that's because of what the B12 does, okay? So your B12 is it's like two main processes, which is making either methionine or succinyl-CoA, which is like these things that it does, okay? They're needed for your body, DNA.
Just go with it, people.
Yeah.
Don't worry about it.
So in one process, B12
Mhm.
will be there to make one of those. And if it's not present, then the MMA will build up. So that's why you would check a B12. And if it's low, then you do an MMA. And if the MMA is high, then you know the B12 is low and
Okay.
it needs to be supplemented. If it's not, then you don't actually, you can like supplement it more with food or stuff like that, right?
Okay.
The other one would be homocysteine and folate. So I always check a B12 and folate together because in your body, in this process, your B12 works with folic acid to make another thing, enzyme, basically.
Okay.
Protein. So the backup of that one is going to be homocysteine. So you look at your folate level and your B12, and if your folate is normal, your homocysteine, if it's high, you know it's B12 issue.
Got it.
So it's kind of confusing, but not really. It's actually kind of a simple process.
Okay.
And when you're thinking of the body, there's a lot worse, harder things.
I'm certain of that.
Yeah. So all important things. Renal disease, that's the other one. People that have renal disease will oftentimes have an MMA issue. So
Okay.
their MMA can be high in renal disease.
Got it. And then there's some medications that can affect your absorption of B12, I think, right?
Yeah, always. Right?
Good old medicine.
Oh no, gosh. That's like kind of sometimes the detriment of us.
Yes, for sure.
So, we've kind of talked about a bunch of things. How do we get it? Like, that's the big question, because I am, you guys might have figured this out by now. My patients have. I'm not a big fan of medicine. I'm a doctor, so I'm not a big fan.
Yeah.
I am all about like, let's try to modify our diet. Let's try to modify the way we're living.
Right.
And then see how can we make this better.
Yes.
So how can we get it from foods?
Okay. So it's actually quite simple.
Oh, that's good.
Vitamin B12 comes from animal products.
Oh, see, I eat those.
The end.
Okay.
So,
if you're a vegan, you're screwed.
Right. Basically, if you're a vegan, we need to talk. But like otherwise, any kind of meat, red meat, poultry, fish, B12. Eggs.
Oh, I like those.
Dairy.
Eggs are my friend.
You can get your B12 from dairy and eggs. So even a vegetarian that eats those things, it's going to be fine.
Yeah.
As long as you eat them on a regular basis. And then if you're vegan, not so much. And so you will probably need a supplement. There's things that you eat that, they add vitamin B12 to. And to me, it's like, what's the difference? Like just take the supplement at that point.
Right.
That's kind of how I feel. But I mean, whatever.
Do you eat eggs?
Yes.
You do.
I do. Don't talk to me about baby chickens. I don't want to hear about baby chickens. Don't ruin the eggs for me, okay?
Oh, I eat eggs.
I know, but
I have a baby chick.
I
have 6 new ones.
I bring that up because my son, when he was like 2, clucked at me when I was eating eggs. And I was like, don't you do it.
That's so funny. This weekend I went to just look at the price of chicks
Okay.
at Tractor Supply this
Mhm.
weekend. And then I was getting permethrin because I have a tick problem on my property, and I was trying to try something new
Okay, sure.
with the permethrin.
It's reasonable.
So my goal was to go in and get the permethrin and just see what the chicks cost. Yeah, that's not a good goal
No.
when you take your child with
Oh,
you.
no.
So we walked out with 6 chicks.
Of course you did.
But I did make sure that they all had to be sexed. So they all had to be females. So now we have 6 hens. Hopefully, well, they'll grow into hens.
Right.
And so we have them in their little pen. And so then we're going over to my mom's house for lunch. This is on Sunday after church.
Yeah.
We're going to my mom's house. And my daughter's like holding the box of chicks. And then she's like, "Oh, Mom, we shouldn't take them in the house. We're eating chicken for dinner for lunch." And I was like, "Just don't show them. They won't know.
Don't tell them. They won't know."
So yeah, now we have chicks. Hopefully I'll be able to get you some eggs in
That'd
the
be
future, because
phenomenal.
I'll have 7 hens then.
Whoa.
Yeah. And
Cool.
they're supposed to be brown eggs. 3 of them are supposed to lay extra large brown eggs, and 3 of
Really?
them are supposed to lay white eggs. And then I have 1 that lays like this greenish blue eggs.
Cool.
So, yeah, I
Wow.
like it all.
So what I'm thinking about for vegans here,
Mhm.
because I know that some people don't like to take supplements, even vegans, even though I kind of recommend it
Yeah.
because it's so restrictive. You can get B12 from, I think, blackstrap molasses, but definitely.
You've talked about that with iron too, right?
Yeah, you get your iron in there. And then nutritional yeast.
Oh.
So, which is not like regular yeast. It's a thing that you like
can put in stuff.
in or on. You sprinkle it. It's sort of like a cheese-like flavor.
Oh.
Yeah, I mean,
Hmm.
if you eat cheese, you're going to want to eat cheese. But I'm just saying, if you don't, then this will work.
There you
Kind
go.
of get your fix. And then it'll get you some vitamins. So,
Okay.
yeah. And then the other thing that I figured out, which I didn't know before looking into this for today, was that vitamin C actually interacts with B12 absorption. So if you are taking a supplement or you're worried about your B12 status, don't take vitamin C at the same time.
Yeah, and you need an acidic environment. So people that are taking, because your parietal cells, like that's in your stomach, and they're creating this acidic environment, right? And so that's where the B12 is being broken off. So if you're taking H2 blockers or any kind of stomach acid lowering medicine, then you're not going to be breaking off your B12 as much. So you're not going to absorb as much. So that's another thought as well.
Got it.
Yeah. So if you are on like omeprazole or any of the other PPIs, and you're thinking about, and then you get diagnosed with B12 deficiency, which came first?
I think we know.
Yeah. So maybe if your medicine is creating a different issue, maybe changing your diet would be a good thing, because then you can lower your indigestion, right? Maybe. And so some people just have bad indigestion, but that's only a small handful of people. And most people with diet modifications, if you avoid your trigger foods, you're not going to get indigestion as much. There are some silent refluxers, but that's like, all right, people, there's something for everything. Okay. There's someone out there that's going to have everything.
Right.
That's how it is. There's an exception to every single rule. We can't say always.
Right, of course.
But there's a lot of people on omeprazole and Prilosec, or that's the same thing.
Yeah,
omeprazole,
whatever.
Nexium. They're on all Protonics. I mean, all of these, and they're on them for the rest of their life. Like they get started on it and they never come off.
Yeah.
And they make you feel better, but then they can create some other stuff like C. diff colitis, magnesium deficiency, B12 deficiency.
Yeah.
And so they're not really benign.
Got it.
even though we think that they are because they're over the counter. They're not. I'm just saying.
And then metformin too does that.
I mean, there's so many medicines out there.
Right. I'm just thinking another common one too.
Yeah.
Right?
Yeah.
A lot of people are on metformin.
Yeah. So, alcohol also.
Sure. Well, in excess, yes.
Yeah. Everyone likes that.
Everyone.
Not everyone, but lots of people. Okay. So how can we, if we don't want to eat it, how can we get it? So if you take it orally, you actually have to take it at high doses. It's like 1,000 to 2,000 milligrams daily.
Yeah. Well, actually, those liquids that we were talking about, like the little dropper, it's like 5,000.
Yeah.
And the RDA is like 2.4 micrograms.
Yeah.
Wow.
Yeah. And so you're taking like 1,000 to 2,000 micrograms.
Yeah.
For like 2 micrograms.
Right.
But you have to do that daily for 2 weeks. And then you actually, after that, you drop down to 1,000 micrograms daily for the rest of your life. Right? Which I think is kind of a lot of B12 that you're taking in. And, you know, it's not all that easy to become B12 deficient, although we've talked about this. But there's a lot of people that are B12 deficient. Which just says something about our diet and what we're doing.
Yeah.
You know, not everyone has intrinsic factor deficiency.
Right.
You can also get a shot.
Yeah.
It hurts. It's not too bad, but it does hurt. With your shot, you can go about it. There's like so many different ways. You can get it monthly until you kind of build up storage. You can do it daily for a couple of weeks. You can do it every other week for a couple of months and then go to monthly. You can do it daily for a couple of weeks and then you can go to every 3 months. It's like there's so many different ways, but it's usually 1,000 micrograms. I usually do it once a month for people. And then we recheck their blood levels. I always recheck the blood levels after 3, basically after 3 injections, which is usually 3 months. So if you're getting it more regularly, then I usually go out like 8 weeks or something like that.
Okay.
And then when you recheck it, you want to look at your B12, your homocysteine, your MMA levels. So you're like kind of basing everything off of that.
Yeah.
So it goes back to our food. Right.
Shocking, isn't it?
We keep saying that.
These are our surprised faces.
I know. We keep saying that.
Yep.
But at least some people out there love eggs.
Like my favorite.
Like me, I love eggs too, Ruth. Okay, so any questions that you guys have, please let us know. And what are we going to do next?
The only thing we have on our list, and we need to work on our list, is vitamin D.
Vitamin D that's actually a great one to talk about right now with the sun coming out.
For real.
And the sun not being out before.
Yes.
That's a great one. We need more on our list. So please, people, if you have a topic you'd like us to talk about, shoot us a line so that we can add it to our list and keep going on our list. I did have a topic and then I forgot, so I'm gonna have to think about it again. It was a great topic, but when I was thinking about it, I was like, oh, this might be too big of a topic.
Oh, that's fine. We'll split it up.
Yeah, that's true. You can do it in months. Any other vitamin deficiencies that maybe we could talk about?
You have to think about that. Probably.
I'm sure there's lots of them. Okay, so that's what we're gonna do. We're gonna think, and you're gonna think, and you're gonna give us some more ideas. And we kept it under 30 minutes. Woo!
Well done.
And we beat B12 to death, like we've done all of our topics. But if you have questions, there's no dumb question, so just ask us. And we will see you in a week.
Yes.
And have a good rest of your week. Oh, and well, I guess just have a good rest of your week. That's all. Okay, bye.